Friction massage. Friction massage is a non-gliding technique that involves repetition of movement transversely, so going across the tissue. It can be used really well for tendons, ligaments, and muscle tissue, but closer to the attachment sites rather than right into the muscle belly. Some benefits. The first one is it gives a pain relief, and it can have an analgesic effect for up to 24 hours after treatment. There's some research on the benefits of scar tissue remodeling, so stimulation of fibre regeneration, and then increased blood flow through vasodilation to the local area. So how to apply friction massage? The technique can be applied by any digit, any applicator, including hand, elbow, supported finger, or thumb. If working on the muscle, the tissue needs to be relaxed. So have your client in a relaxed position onto the couch. If working on a tendon or a ligament, it can be placed on a slight stretch. The important thing is there should be no lotion with this treatment. If you have used lotion to warm up the tissues to start with, use the cloth to dry off any excess lotion, or use a cloth for the friction technique itself. The motion should be firm and rhythmic movement which goes across the fibres. And always make sure your power comes from your back legs. That pressure from the back legs is really important to apply that rhythmic motion that you need for the friction technique. And you'll see the difference when you're using your shoulders or pushing off your back leg in the video.
So here we go into the technique for friction massage. So you want to make sure you've warmed up your client beforehand, so you can start with your compressions into your effleurage and petrissage. And when it comes to friction massage, you often find those areas of stuck tissue closer towards the joints around that tendinous area, and that's where we want to sort of be working. So with the technique, it's a rhythmic motion, and you can use any applicator on that area from here. So I'm just going to spend a little bit of time just doing some effleurage on this side of Pentonese, just to keep the area nice and warm. And as I'm doing that, I'm scanning and seeing what's happening in her tissue. As you've used lotion, it might be quite slippy through here, so you can use friction over your little cloth. Or if you're directly onto the skin, there's no lotion, you can do it onto the skin as well. But I'm going to use this little cloth around the area. I'm going to direct my focus around the intrascapular area, so around where levator scapula is, and into the rhomboids as well. So using my little cloth from here. Now I'm going to start with my supported thumb. So my underneath hand is nice and flat, supporting with the other hand. I'm finding that area of tissue that I want to be working. Into my lunge position. And from here, I'm going to be coming towards the spine. So in my lunge position, towards the spine, I'm going to take small motions, rhythmic motions, forwards and back onto that tissue. So from there you can use your thumb. You can go into fingers, supported fingers. And if you wanted to around the area, you can also use your elbow also. So again, supporting through the elbow, finding that point, and then small motions forwards and back. Other areas you might want to focus on when it comes to friction is the area around the top of the scapula into upper traps as well. So from here, once you've done your area to warm up, I'm going to work around the top part of Pentonese upper traps from here. So using my little cloth again. And then with my fingers, I'm going to just take those small motions forwards and back. For using a different applicator, you can also use your elbow. I'm going to just focus on elbow into the erectors. So finding the area you want to be working on. Supported elbow. And I often use my supporting hand around the elbow just to keep my elbow in the same direction that I want it to go. And again, small motions. And it's important when you're doing this work as you're pushing off on that back leg and not using the shoulders, because it will feel completely differently. So if I come into my lunge and I'm pushing off my back leg, my whole body feels quite relaxed and my legs are doing the work. But as I start to do this, Penton, how does it feel in comparison?
Uncomfortable.
So it was uncomfortable for the client. So keeping it small and pushing off the back leg, so my whole upper body is staying still, but that force from my back leg is allowing that friction motion to happen.